Dear friends, in this presentation, today we are going to discuss about the pathological aspect of dictatorship, a journey into the dictator's mind, cult of personality. Certain psychopathological aspect and specific diagnosis of XX 4th century dictators are described and discussed in this video. Their childhood experiences, attachment to parents, education, and occupation prior to becoming dictators portray a relationship to becoming megalomaniac sadists. They were all narcissists. Scholar James Fallon, a neuroscientist, says that dictators are psychopaths. Dictators are usually attractive, charismatic, and remarkably intelligent. They bring with self confidence, autonomy, and exude sexual energy. They are also extremely self absorbed, masterful liar, compassionless, often sadistic, and possesses a boundless appetite for power. Secondly, dictators are paranoid narcissists. World Health Organization in 1948 defined the health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Dictators are usually charismatic and intelligent individuals. They are extremely self-absorbed and pitiless people, portraying their self-confidence and independence. Dictatorship characterized by having absolute sole power over the people, and this power is usually used in a cruel way. However, a dictator disrespects the basic political, socioeconomic, and cultural human rights, which are fundamental to human health. The glorification of dictator has been called cult of personality. Modern dictator must create illusion of popular support or consent by rigging electoral system. By considering the range of 20th century dictators, Benito Mussolini, Mao Tse-tung, Joseph Stalin in Soviet Russia, dictators acutely suspicious of others, they surrounded themselves with flatters. Mussolini trusted no one. Stalin had no friends and no allies. Personality psychologist Frederick Coolidge and Daniel Siegel from University of Colorado wrote that Jung said Hitler never laughed, and it appeared as if Hitler was sulking and in bad mood. In 2007, psychologists rounded up five experts on Hitler and asked them to evaluate him on a basis of DSM-4, psychopathological syndrome, and personality disorder. The consensus was that Hitler had highly elevated score on the following personality disorder scale: paranoid, antisocial, narcissistic, and sadistic. Hitler derived personality profile suggested that he probably had schizophrenic tendencies, including excessive grandiosity and aberrant thinking. Murray and his colleagues concluded that Hitler was an insecure, impotent, masochistic, and suicidal neurotic narcissist who saw himself as the destroyer of antiquated Hebraic Christian superego. Narcissistic individuals have greatly exaggerated sense of their own importance and they are preoccupied with their own achievement and abilities. They see themselves as a grandiose, have difficulty in empathizing with the feelings and needs of others, and they tend to be vindictive. There are the two forms of narcissism, grandiose and vulnerable, associated with an insecure grandiosity, which is seen to produce intense defensiveness and a feeling of inadequacy. Such individuals are often described as being worrying, emotional, defensive, anxious, bitter, tense, and complaining. Many believed in cult of Stalin, Mao, Hitler, and Mussolini. People had to acclaim their leaders and shout party slogan on command. The purpose of cult was not to convince or persuade, but to sow confusion, destroy common sense, enforce obedience, isolate individual, and crush their dignity. This component can be so extreme that narcissistic personality disorder can be misdiagnosed as borderline personality disorder, which is associated with a high level of anxiety. Anatomically speaking, amygdala is a major center for circuit that mediate animal instincts, regulate fear, rage, and sexual desire and emotional memory. At the bottom of the brain, lower frontal lobe, orbital, ventromedial, prefrontal, and anterior cingulate cortex, there is a circuit that is usually damaged in psychopathic dictator, where aggressive impulses originating in a amygdala are inhibited and moral ethical choice are considered. Thus, the psychopathic murder show functional loss in orbital ventromedial cortex of frontal lobe, anterior medial temporal lobe, especially in amygdala. The warrior gene or monoamino oxidase A, which is more prevalent in men, may also play a role in psychopathic murderer, and it is transmitted from mother to child through X chromosome. An individual that has been seriously abused in the childhood and or lost important caretaker such as biological parents is at risk of becoming an aggressive psychopath. The totalitarian dictator seek to maintain complete control over their respective governments and population through radical methods including systematic murder, imprisonment, torture, and forced labor of all the opponent. Joseph Stalin, born to a poor family in Georgia as a young child, underwent severe physical and psychological distresses that affected his adult life. Young Stalin had a negative self image and was plagued by inferiority complex. In his entire life, Stalin struggled to overcome his negative self image and inferiority complexes by inflating defensive, high self esteem. He lacked empathy. Stalin suffered from malignant narcissistic syndrome with an extreme lack of empathy, elements of sadism, and paranoid tendencies. He organized many armed robberies to raise the fund for the party, was arrested for revolutionary activities, and exiled to Siberia. Stalin worked with Bolshevik as a pragmatic activist and was highly manipulative. Stalin was able to win Lenin trust since he had organizational skill and was had a hard worker. He used ruthless measures during the Russian Civil War, earning a fearsome name. He was rude, intolerable, and had a bad temper. In 1924, Lenin wrote to the Central Committee that Stalin must be removed from the post of General Secretary of the Communist Party of Soviet Russia and be replaced by someone else, more loyal, more courteous, and more considerate of comrades, less capricious. But this decision was overruled by Stalin with the help of his supporters in the Politburo. Stalin encountered series of identity crises throughout his life, probably due to insecurities that vastly affected to him. His defensive high self-esteem created a new cult in the Soviet Union. The Stalin's pictures replaced the God's image. He became a demigod and launched a anti-religious campaign against the Russian Orthodox Church. Stalin attempted to construct legitimacy as a successor to Lenin through the development of a cult of personality whereby he is portrayed as a communism first philosopher after Karl Marx, Engel, and Lenin. On 6th March 1943, Stalin bestowed upon himself rank of Marshal of the Soviet Union. He was proclaimed that greatest strategist of all time and all people. Stalin paranoid defenses grow more and more. He saw spies, saboteur, foreign collaborator everywhere, fearing his own shadow and trusting no one. His list of enemies became always longer, and his rational thinking was inhibited by fear and paranoia. Diagnosis of paranoia is well described in ICD-10 manual. The paranoid personality disorder, excessive sensitivity to rejection, bearing on slight suspicion, tendency to distort experiences, neutral or friendly action of others, misinterpreted as hostile or contemptuous, recurring unjustified suspicion regarding sexual fidelity of spouses or sexual partner, continued insistence on their own rights, inflated self esteem, and frequent excessive self absorption. Stalin was a covert anti Semite. In 1930, he publicly stated that anti Semitism is an extreme form of racial chauvinism. He took a number of measures to suppress Jewish people in the Soviet Union. One of the strongest aspects of his anti-Semitism was its manifestation at the time when he was supporting the creation of State of Israel. Stalin felt empty and bored inside, probably due to his inferiority complex. The great Russian psychologist Vladimir Mikhailovich diagnosed the Stalin's neurotic triad, that was, he suffered from paranoia. In the later year, some prominent Soviet psychiatrists suggested a number of other aspects of Stalin's psychopathology, that is, paranoid schizophrenia, a delirious condition derived from paranoid psychopathy, placing Stalin in the category of epileptic psychopath. Other psychiatrists stated that Stalin was cruel, devoid of any feeling of pity, completely amoral. Stalin could disconnect himself from warm and human emotions. He emotionally cut himself off from individual close to him was one of the sources of his cruelty. He was a self-centered person and isolated character who had no value in friendship. Stalin was troubled by delusion of conspiracy and feeling of victimization. He saw enemies everywhere. He rejected medical advice, listening to the veterinarian and treating his hypertension with iodine traps. His medical and physical health started to deteriorate rapidly. He became more suspicious, irritable, and paranoid, and suffered at least one stroke prior to his fatal intracerebral hemorrhage in 1953. The most plausible explanation of Stalin's late behavior is the dimming of the superior intellect and unleashing of the paranoid personality by a multi-infract state. He showed all the signs of hubris syndrome. This is first described by David Owen in 2009. Hubris means pride. It refers to a syndrome, a cluster of symptoms, or a disorder of possession of power. It was a pattern of behavior in a person who sees the world as a place for self glorification through the use of power, has a tendency to take action primarily to enhance his personal image, exhibits messianic zeal and exaltation in speech, conflated self with the nation or organization. He uses the royal we in the conversation, shows excessive self confidence, manifestly has contempt, contempt for others, loses self contact with reality, resorts to restlessness, recklessness, and impulsive action. His delusions and obsession caused millions to suffer a troubled upbringing, depression, paranoia, alcohol abuse suggest psychopathology as an implicating factor behind his action. Adolf Hitler suffered from manic depressive syndrome. Hitler has two phases: ecstatic dedication and activity, while on other hand he had a dangerous fits of depression. After Vienna Academy of Arts rejected twice admittance of Hitler as a student, he fell into deep paranoid delusional depression which gave rise to anti-Semitic hatred. During the depressive stage, Hitler was despairing, indecisive, isolated, and unable to care for himself, to concentrate, and to remember. He was hesitant, confused, despondent, and apathetic, and had a phobic dread of horse, water, and the moon. He washed his hands constantly because of his obsessive fear of germ. He had a phobic aversion of and paranoid delusion about Jews as a contaminant and compulsively tried to cleanse the world of them. During the manic stage, he was egotistical, arrogant, grandiose, aggressive, and irritable. He had a grandiose Aryan delusion of omnipotence, invincibility, and fallibility, violent mood swing, rages, racing thoughts, and pressure of speech. His overwhelming emotional force and persuasiveness, both symptoms related to mania, were instrumental in convincing millions of his countrymen with his grandiose and paranoid delusion. Hitler's hatred of Jews emanated from his paranoid, obsessive, and delusional fear of them. The paranoid delusion of manic depressive leads to induced psychosis.